blocked nose all the time? You wake up tired. Your mouth is dry. Breathing feels like pulling air through a straw. You blame a cold. You blame the weather. You blame dust. But what if the real reason has been silently growing inside your nose for months, even years? Today's topic is nasal polyps. Nasal polyps are soft, painless, non-cancerous growths that form along the lining of the nose or sinuses. They don't look dangerous. They don't feel dramatic. They grow quietly, like fog slowly filling a room. Small at first, almost invisible. But over time, they can change how you breathe, how you sleep, and even how you experience the world. These growths are often yellowish, pinkish, sometimes teardrop-shaped. They may grow alone, or they may cluster together like grapes hanging inside the nasal passage. When they become large or grouped, they block airflow. That blockage leads to pressure. Pressure leads to inflammation. Inflammation leads to infection. And the cycle continues. Imagine trying to live your life with a door that never fully opens. That's what chronic nasal blockage feels like. Some people lose their sense of smell. Food tastes dull. Coffee has no aroma. Fresh rain carries no scent. The world becomes quieter in ways you didn't expect. Others experience constant post-nasal drip, facial pressure, headaches, snoring, even sleep apnea. Nights become restless. Mornings feel heavy. Most small polyps cause no symptoms at all. That's the deception. The silence. Nasal polyps are more common in adults over 40. Men are affected nearly twice as often as women. But anyone can develop them, especially those with chronic inflammation, asthma, allergies, recurring sinus infections, or immune conditions. The inner lining of your nose, called the mucosa, is meant to protect and humidify the air you breathe. But when irritation lingers for too long, that protective layer can swell and reshape itself. And from that swelling, polyps may form. Sometimes there's no obvious infection at all, just ongoing irritation, airborne allergens, sensitivity to medications like aspirin or ibuprofen, genetic factors, even chronic diseases such as cystic fibrosis. It doesn't happen overnight. It builds slowly. And here's the unsettling truth. Most people dismiss the early signs. They normalize constant congestion. They adapt to poor sleep. They accept losing their sense of smell as just aging. But what happens next will change everything. Picture someone who hasn't breathed freely in years. They don't even remember what clear airflow feels like. They assume it's normal. That's how nasal polyps steal comfort, gradually, quietly, almost politely. Diagnosis begins with listening. A doctor will ask about your symptoms. How long has the blockage lasted? Have you lost your sense of smell? Do headaches wake you at night? Then comes visualization. A small lighted instrument may be used to look inside the nasal passage. If needed, a thin, flexible scope with a camera explores deeper into the sinuses, revealing hidden growths the naked eye cannot see. Imaging, like a CT scan, maps the landscape. It shows the size, the location, the extent of inflammation. Allergy tests may uncover triggers, silently fueling the problem. And in children, doctors may screen for underlying conditions, such as cystic fibrosis. Treatment usually begins gently. Nasal steroid sprays are often the first step. These medications calm inflammation, shrinking polyps gradually. Sometimes oral steroids are prescribed for stronger, short-term relief. Antihistamines help if allergies are involved. Antibiotics may treat associated infections. But if the polyps grow too large or refuse to respond, surgery may be required. A procedure known as polypectomy removes the growths using specialized instruments. It's common, generally safe. But here's what many don't realize. Surgery removes the polyps, not the underlying inflammation. Without addressing the cause, they can return. That's why long-term management matters. Controlling allergies, managing asthma, avoiding irritants, reducing chronic inflammation. It's not just about removing something. It's about changing the environment that allowed it to grow. And this is where the video takes a shocking turn. Because nasal polyps are not just about breathing. They're about quality of life, about sleep, energy, focus, even mood. Chronic inflammation affects more than the nose. It affects how your entire body feels. Most people never hear the next part, and that's the real danger. Ignoring symptoms allows the cycle to deepen. Early action makes everything easier. If you've been living with constant congestion, don't ignore it. Don't normalize discomfort. Your breath is your life's rhythm, and you deserve to experience it fully. Thank you for watching. If this helped you understand what might be happening inside your body, like and share this video with someone who struggles with a blocked nose. And subscribe to Befitist to stay informed, empowered, and one step ahead of silent health threats. Because sometimes the smallest growth can create the biggest obstacle.